Hello, and welcome everyone to the second webinar of this year's Focus on Eye Health webinar series, Collaborative Solutions for Expanding Eye Care Access in Special Populations. Thank you for joining us today from across the U.S. and the world. I'm Kira Baldonado, Executive Vice President at Prevent Blindness. A description of myself, for those who may not be able to see the screen, I'm a middle-aged, we'll stay there for a while, Caucasian female with strawberry blonde hair. I'm wearing some olive green glasses and a patterned shirt dress with a plain tan wall behind me. So I'm pleased to be with you here today. Since 1908, Prevent Blindness has been dedicated to preventing blindness and preserving sight, a mission we elevate through three strategic pillars: educate, advocate, and collaborate. We've championed eye health and safety by educating the public, advocating for equitable access to quality eye care, promoting the early detection of vision problems, and empowering patients and their care partners. Prevent Blindness and our state affiliates serve as a trusted resource in all things vision and eye health, with the following impact in the last year alone. In policy and advocacy, we've had more than 8,150 engagements with members of Congress. We've reached more than 2.4 million people through vision screenings, referrals, eye exams, and treatment. And we've trained and provided technical assistance to more than 12,900 individuals and are increasing public awareness about eye health through nearly 1 million people directly and reaching more than 3.7 billion with a B media impressions. We're proud to Prevent Blindness as we serve as a convening organization to bring people and organizations together for sight. And we thank all of those who have worked with us to elevate vision and eye health as a key aspect of overall health, education, employment, and ensuring the highest quality of life for all. This webinar series goes to our longstanding tradition of bringing together diverse voices to explore vision from a public health perspective. This year's theme, Powering Partnerships to Advance Eye Health, reflects our focus on strengthening partnerships at all levels to advance innovation and sustainable solutions in policy, access to care, patient engagement, research, and clinical interventions. Throughout the series, we'll discover how partnerships can improve access, strengthen systems of care, and advance overall eye health. But first, I'd like to thank the many sponsors without whom this event would not be possible. Our platinum sponsors include the Alliance for Aging Research, Genentech, and Pharma. Thank you also to our many silver sponsors seen here for their generous contributions to make today's webinar possible. Recording from today's session will be added to the Focus on Eye Health webinar series event webpage, preventblindness.org/FOEH within a week. You can also access presentations from previous summits here. In addition, you'll find speaker and moderator bios and other resources can be found on this page. And of course, we encourage you to follow Prevent Blindness on our many social media platforms to stay up to date on our latest events and follow our vision and eye health information. You may wonder, where's Kim? Unfortunately, Kim Shuey Greenberg was unable to moderate the session today. The airlines changed the schedule, so I'm happy to be with you. Now let's get started with the second webinar of Prevent Blindness's 2026 Focus on Eye Health webinar series. Today's conversation focuses on collaborative solutions for expanding eye care access in special populations, specifically foster youth, immigrant and refugee populations, and tribal communities. We will discuss practical strategies and actionable ideas for building and strengthening partnerships to advance eye care access in these populations. We're fortunate to have a wonderful group of panelists with us today, all of whom have deep experience and knowledge of working with these special populations. I'm looking forward to hearing their perspectives on where the biggest challenges and opportunities are, what stronger partnerships can look like, and tips to how to work with these groups. I'd like to take a moment to introduce today's panelists. Dr. Kristine Fortin is an attending physician at Children's Hospital of Philadelphia and an associate professor of clinical pediatrics at the University of Pennsylvania School of Medicine. Dr. Julie Lay is the chief of specialty services and eye care at Lowell Community Health Center in Massachusetts. And Lori McCoy is the director of global outreach at the John A. Moran Eye Center at the University of Utah. Please welcome all of our panelists. So with that, here they are. Let's get started. So to set the stage, could each of you briefly introduce yourself, describe the communities you work with, and share what drew you to this work? Kristine, can we start with you?
Sure. Hi, everyone. Thanks so much for having me today. My name is Kristine Fortin, and I have brown hair, and I'm wearing a green sweater today. And like it was mentioned, I'm a pediatrician at the Children's Hospital of Philadelphia. And as part of my role, I serve as medical director for a clinic that specializes in caring for children in foster care. And it's really important to have a specialized clinic for children in foster care because the American Academy of Pediatrics designates this population as one with special healthcare needs. There's a high prevalence of unmet healthcare needs among children in foster care for reasons such as during times of family stress and trauma, there could be less access to regular healthcare. So children would miss screenings like vision screenings. And also, trauma can impact health, including vision. Children in foster care also face unique barriers to healthcare access that we'll be talking about today. So I got drawn to working on projects to improve access to vision care for youth in foster care simply by observing in our clinic that, one of the first things we do when children come to our clinic for their appointments is vision screens. And we just kept seeing a pattern of children with really abnormal eye chart vision screens. And they would explain they didn't have glasses because they got moved to a new foster care placement and the glasses got left behind. So there seem to be really unique barriers to vision care for youth in foster care. So our team embarked on a series of projects to improve access to vision care, and I'm excited to share more today.
I look forward to it. Lori, tell us a little bit about yourself and what drew you to your work.
Hi, my name is Lori McCoy. I have blonde hair. I am currently in where I'm at Philadelphia in a hotel room, and I have a white shirt on. And a little bit about myself is I have been in the eye care field since I was 15 years old. I am well over that now and have made my way around different specialties, different parts of vision screenings, and just fell in love with the whole aspect of it. I learned how to do surgery. I learned how to do pediatrics. I learned how to do adults. I learned how to do all these different components. And when I was looking for my next career change, I wanted to see where I was going to expand to, and went to the John A. Moran Eye Center, and they had all the subspecialties there, and went on my first outreach trip to Guatemala and knew that this is where I wanted to end my career, is serving populations that did not have access to care. And there are barriers when you work in a clinic setting. Everybody that comes in has insurance and has access to care, but in remote areas, working like we do on the Navajo Nation, their barrier is trying to find a place that they can get access to. So we've been serving on the Navajo Nation for over 10 years and providing eye care for surgery, exams, glasses, anything that is needed down there, and know that this is the population that I wanted to help, and have enjoyed every minute of my last 12 years help doing community outreach.
That's amazing. So we're going to learn a lot from you. Julie, tell us about yourself and what passion you have for your work.
Hi, everyone. Thanks for having me. I'm Julie Lay. I'm an optometrist, and I am a middle-aged, have female for those who can't see. I have dark black long hair with the black glasses on, pink jacket, and I'm sitting in front of a picture of a brick historic mill building, which is Lowell Community Health Center, where I am the chief of eye care services here. And Lowell is a really diverse, multicultural, multilingual community in Lowell, Massachusetts. Our medical home at the Community Health Center has been here for over 50 years. And I had the opportunity and privilege to help open their eye care center. They've never had eye care services before here, about 9 years ago through a HRSA expansion grant. And so it was a very great opportunity for me to improve eye care services in this area and population. But what really drew me to working at a community health center, I've always been in private practice as an optometrist prior to being here. And my parents are immigrants from Vietnam. So we had the same kind of challenges that many of our patients that I see today have. and just learning the system, health literacy, navigating a complex care system like we have. And so I just wanted to be able to work in that type of community and be able to improve that as well in my, I like to say, later part of my career or middle part, depending. So, this is really the draw for me, where our community health center is a recognized center for culturally competent care. And that was extremely important to me, to be able to make sure that our patients are spoken to in the language that they're most comfortable with, but also that we can understand the different cultures they're coming from and be able to care for them in that way. So looking forward to sharing all of those things, good and bad, that I've learned over the last 9 years. And also learning from others that are here today, not only as a panelist, but those that have been able to join us today. So thank you so much for having me.
Oh, that's great. There's a lot to dig into there as well. And I can say there's already been conversation sharing between this group, and I know we'll learn a lot today. So Lori, I'm going to start with you. From your perspective, what are some of the biggest vision and eye health challenges facing your population? And what are some of the stories that have stuck with you about eye health needs in the population?
Well, for me, working in the Navajo community, it was the vastness of the community. There's many places that where we work, which is only 6 hours from Salt Lake City, that still don't have running water or electricity. And so you would think everybody at this day and age has running water and electricity, but they don't. And so it's kind of very challenging for them. Even gas money to get to clinics, being able to get to these services is a challenge for them each and every day. And trying to provide this care in this community of how they're going to receive this care. And so to me, being able to provide these services as close to home as they are, coming to them, not them coming to me, has been very successful for us to be able to provide that care, is going to the patient, not making the patient come to you.
Yeah, thank you. I'm in a meeting in LA right now. We just heard that same concern for another health topic. If you don't have electricity or running water, it's really hard to be able to access any other health issues then. So Julie, tell us a little bit about your population. What are some of the biggest vision and eye health challenges?
Well, number one for us here is language, being able to provide language services. Transportation is always another issue, but really like insurance and not being able to pay for some of the services that we have and are able to offer. And so I was just, my day can be as crazy as seeing patients that speak Spanish in one room, Portuguese in another, Pashto in another, Swahili in another, and that's one day. And so it's pretty vast in terms of our type of patients that we see. But really, like, how can we navigate those challenges where they can't afford these simple things? And along with, as Lori said, being able to access things like a comfortable home, a safe home. So that's been a challenge, but also understanding culturally what our patients need. Like, we have a large Cambodian population in Lowell, and they unfortunately went through, some of our patients, the Khmer Rouge. And so our patients actually, when they were living in Cambodia, if they had glasses during that time, they were isolated and jailed or killed. So our patients that need glasses aren't wearing them because of these sort of cultural issues. So it's really important to understand that when you're community. And I think that's the hardest thing for us, is there's so many things that are factoring into just their general health. So that's learning and understanding that is key.
Really shapes the way you educate and outreach. Kristine, what about you?
One of the patients who really inspired us to start this work is an 18-year-old, just wonderful, smart, brilliant young lady who had just moved into independent living. So she was living on her own and she was still in the foster care system and had a case manager. And she was really trying to adjust to her new living situation and figure everything out and figure out how to take care of her own medical needs and get her insurance information together. And she had also just started community college and adjusting to new academic life. And she realized that she couldn't see very well in her classes, so had borrowed her friend's glasses. And when she came to our clinic for the vision screening, her vision screening was actually worse with the glasses on than it was without the glasses on. So really tried to then communicate with her case manager who'd known her for a while and said, "Oh my goodness, I just never knew you needed glasses. I didn't know." So I think this really illustrates some of the unique barriers that children in foster care can experience. There's a lot of competing needs, a lot of like adjusting to independent living, and also a lot of other medical needs. There's communication gaps because there's more people involved in the care. Every child in foster care will have a child welfare or child foster care agency case manager. So there needs to be more people involved and to communicate. There can also be insurance issues. When children enter foster care, they're assigned a new Medicaid plan. So sometimes there's just delays in getting the plan or communication. And then, like was already mentioned, some concrete barriers like financial barriers, transportation.
Oh my, so much going on there. Even with, as you describe all these different populations, one of the essential things in each of them is going to be trust. Each of them have been through a lot in their lives already. So what approaches have been most effective in building trust with the communities you serve? Julie, would you like to kick us off?
Sure, thank you. One of the key things is to, partner with people that have trust in your communities. That's an essential piece, I think, too. And for me, as I mentioned earlier, it's the language, being able to speak the languages that, so that it can trust you and in order to be able to do the treatment plans that you recommend for them. But for us, we've been very fortunate in that we have a Massachusetts League of Community Health Centers that really pushed through a project of adding school-based health centers. And so what we found when we opened up is that our young patients weren't able to get in because all of our after-school appointments were fully booked. It would take 3 or 4 months to get in. So we found this big need because of the scheduling issues to try to get these young students in for their eye exams. And we had a grant given to us by the Association of the Clinicians for the Underserved so that we can purchase equipment to go and go into our school-based health center. So we're located in Lowell High School. And so the trust is there because the kids are already going to school there. They don't have to take time out of their school day to be able to see and get an eye exam. Their parents don't have to take time off of work. And they're in an environment that they trust because, they're going to school there. And so it was really helpful for us to partner with Lowell Public Schools to be able to do that. We also couldn't get to everybody. It's very challenging for us to get to everybody. So Onsite 2020 is a mobile vision van that comes to the elementary schools. And so there are kids that might need additional services, optical services that they weren't able to do. So we're serving as a secondary, resource for them. So just being able to find these types of partnerships and collaborations is huge. And I think that's important when you're working and you can't do everything, resources are limited. But we found that going to the schools, as Lori had mentioned, going into where your patients are needing you is very important.
Excellent. Thank you. Kristen, how about you?
As part of our project, our team was able to use different qualitative methods to talk with all key interest holders. We were able to speak with youth in foster care, foster parents, medical providers, court professionals, child welfare professionals. I think engaging key interest holders in designing the projects and the policy recommendations is important to building trust. And it also gave us insight into what would build trust. And one of the key things that came out of our interviews with youth with we were really fortunate to get a grant from the Warby Parker Impact Foundation. So youth in our clinic had the option to go to the Warby Parker store and get their eye exam and pick out glasses. And when we did qualitative interviews with them, all the youth were saying like they had just such a great experience at the store. They felt they were treated like with such kindness and respect, and they had so much fun, and they just loved being able to pick out whatever glasses they wanted. And the youth were saying like, I just felt so pretty in the glasses. I felt so much more confidence. So that was a really key thing, was having a really positive eye exam experience and really positive experience with having the agency to choose the glasses that they loved and really made them feel confident. I think that really built trust.
Yeah, that's wonderful, giving them some sense of control in their lives. So, Lori, how about your work with the tribal communities?
Well, with us, I think at the very beginning, the biggest question is, are you coming back again? So making sure that the things that you promise are actually what you're going to be able to deliver on. So, coming up with a good plan, sharing your calendar, yes, this is when we're coming back. And so they have a good understanding. The other thing too is building that relationship with those providers that are already providing care. We work out of their facility where they already go and receive care. They feel safe when they go to these facilities, and being able just to know that we're in that facility, they'll come there. We've built that relationship with those partnering groups that are already providing care, but also, making sure that we are working with like a community liaison from those clinics, that they have someone to be able to speak to, right away, to make an appointment, to be able to be seen, any questions that they have. Since we do travel down 6 hours, we're not always there on location. And so we only go about 6 times a year. We used to go every month for the first 5 or 6 years. We went every single month. And so being able to drive down there every month was a lot of work, but, we showed up. That's what they want. They want to see that you're going to show up, that you have their best interest in mind. And so being able to do that, and then taking recommendations from us. Hey, we think that you should really hire an optometrist. There's enough need. We're seeing 200 people on a Saturday every time we come down here. I think that you really need to see about hiring an optometrist. And now the facility, or UNHS, who we work with, has 3 optometrists. And so they've taken that recommendation and really working together as a team. We go down there, provide surgery. We go down there and provide eyeglasses to some remote areas, places that they don't always go. They are expanding their care in some of their community clinics, but also, like I said earlier, bringing the care to them, having that relationship, creating a community liaison that can answer questions when we aren't there. They know they have someone within that organization, someone who lives in their community that they can reach out to and have a question if they cannot reach us for some reason.
So do what you say you're going to do, and be there, and be a trusted partner working with those trusted leaders. So,
Yes.
And being in those trusted locations, it sounds like, are all important things to consider as you're putting programs together.
Yes.
So let's dig into the foster youth for a moment, Kristen. For youth in foster care, you had mentioned the story about the one individual who had been changing placements and left her glasses behind. We know that continuity of care can be difficult. So what are some of the strategies that you've learned to help ensure that the children and adolescents receive consistent foster care, follow-up, or have that consistent access to eye care?
Yeah, really, it's really thinking about what foster care is, to think about how we can develop solutions. So like you mentioned, there's a lot of changes in living environment, and there are different types of foster care placement. Some children are placed in kinship care, so they may be placed with someone who knows a lot about their medical history, but other children are placed in non-relative care, so they're placed with someone who wouldn't know that they needed glasses. And when a child's in foster care, the hope is that they would remain in one stable placement during their time in care, but some children do change placements during their time in care. So each time they change placements, that's another opportunity for them to lose their glasses. So this was considered in part of our policy initial recommendations that we made, and I think we put the link in some of the materials that you'll get after. But some of our thoughts were that it would be important to really maximize opportunities to vision screen, so that if a child did lose their glasses, they would have opportunities to catch that they need glasses. And that would be at medical appointments, and thinking about other opportunities like screening in child welfare settings or in the court. We did study extra supports for vision care, like providing case management and transportation, and those were really effective. We also thought about how important it is to document in medical records and in child welfare records that a child needs glasses, so that if they are changing placements, then it's really clearly documented. And then another thought was about Medicaid coverage. So all children in foster care are covered by Medicaid. And if they're at a population that's at really high risk for losing their glasses, that perhaps Medicaid would need to cover additional pairs for youth in foster care so they could be entitled to additional replacements if loss happens.
Those are all excellent ways, and I appreciate you're looking at that systems approach to where are those opportunities. Just one quick follow-up question: has there been discussion around vision screening training for the caseworkers themselves? You had mentioned the one who said, "I didn't know he even needed glasses." So, has that been something you've thought about?
Yes, we actually have a community advisory board located within one of the foster care agencies. And so we're working through that question about how we could vision screen. And it's so important to get input from all the key stakeholders because the the children are placed in foster care with an agency that's in their neighborhood, but then they may be placed with a foster parent who lives really far away. So when we thought of the idea, the foster parent was said, like, I don't actually go to the foster care agency that much because I live far away from it. So we're thinking through like when could be the best time to do that. It could be maybe when the children are visiting, if they have supervised visits with the family of origin, or maybe training people who go out to the home to conduct home visits. So we are thinking through that, and there's so many people, and I really highlighted how important it is to get input from everybody involved, like the foster parents and the child welfare, to make something that could work.
Excellent. All right. Julie, tell us a little bit more about the immigrant refugee population that you work with. What are some of the most important culturally and linguistically responsive approaches that you've employed to improve eye health awareness and access to care?
Well, I'm very fortunate that I'm in a community health center for over the last 50 years. They've been trying to include some certain things and aspects that would help these patients that are coming into our area from a different country. So one of the things that's been helpful for us is we have medical interpreters that we have on site, but those resources are limited. So it's very challenging for us, when we don't quite have the ability to communicate with our patients in the language they're best served. The other thing we have, which is very important too, is insurance navigators. Many of our patients can't afford care, and we have sliding fees, for example, that help and kind of covers those gaps that the patients have in terms of their coverage of insurance or lack of. So that's been helpful for us too in the eye care area. But really, what I found that was extremely helpful too, I hate to say this, but I think technology is helpful for us these days. In private practice, I was able to pretty much speak mostly English in my, practice, prior to coming here. But when I cannot get to know my patients well because my resources are limited, I don't want to be on the phone with a medical interpreter, that I have to pay for to find out if somebody's summer is going well at school or whether or not their, family is doing well. I feel like when we're building trust, you got to get to know your patients. And so it's really key for us to utilize services like we have a pilot program for Lexi, which is a medical interpretation service. So I'm using Lexi to try to get to know my patients. So I'm not utilizing precious resources like our in-house interpreters for beyond things that we can't necessarily talk about, like glasses. Many of our patients have never worn glasses before and really don't understand the basics of glasses, how to take care of them, how to use them. And so in addition to that, if I have to send patients to specialists, I have to talk to them about their insurance, where I can send them, where I can't send them, because their insurance isn't covered at specialists in the area. I have to send them to Boston, for example. So we're really struggling sometimes, and we are thankful that we have community health workers as well. So they can outreach. For example, I had an Afghanistan family that came. They all needed glasses, but they really cared about the fact that they needed really nice rugs to pray on because they just came to to Massachusetts and they did not have any. They didn't have any warm clothes because they came in the winter time. So there was nothing that they had that they could live. So, it translates beyond that. So we have nice wraparound services at our community health center here. But we also rely on community partners, because if we didn't have an International Institute of New England to help let us know that this patient needs glasses, how are they getting to us? Or if we don't have community partners that are providing food or clothing for these patients, we wouldn't be able to do what we can do for those patients. But in terms of eye care, I do a lot of health literacy education, and it takes a long time. And so it's really expensive to be on, translation lines, if our in-house interpreters aren't available. And so using technology is helpful to try to bridge that gap. But that's probably one of many barriers that we have at Lowell Community Health Center. But, like I said, fortunate that we have these resources. But again, happy to share, what we can with others today.
That's amazing. So, and we know that you mentioned the insurance guidance that you give. Insurance is difficult for everybody, let alone if you're new to this country or new to the language. So that's a critical support there.
Yes, it is.
Lori, now the population that you're working with in the tribal communities, what are the most important considerations for organizations that would like to engage in respectful and effective ways with this population?
Well, I think for us, it's, and probably most of our programs across the board, is about communication. It's like really understanding what they want you to help them with. Instead of going in there, we had some thoughts of when we started working on the Navajo Nation that there was one provider, but it was a couple hours away, not as far as we were, and we were going to go in and try and help with surgery and things like that, and kind of like feel like we were going to save the day. But that was not their greatest need. Glasses, eyeglasses, refractions, a place to be able to go and just get basic care was what their greatest needs were. So after, we've been there twice, we said, okay, we really need to think about this. And we sat down with all the community centers, some were closer to, cities than others, and said, what are your needs? What are you finding that these patients are really, really in need of? Let's come up with a plan together, rather us coming in think we're going to know everything, and we didn't know half of the stuff that what their needs were. And so really communicating with those community partners, no matter where you're at. We work in the Salt Lake Valley as well. We do 72 other clinics besides with refugees, with the homeless population. And before we go into each of these centers, and even international, our work, we try and do either a needs assessment or sit down and do a site visit and say, okay, tell me what I can do for you, not what I think I can do for you. So really understanding what those needs are, and what they're asking for, and how you can get their buy-in, because that's when your program is going to be the most effective. But also, if you have their buy-in and their support, they know that you've come up with this plan together. You just didn't do it all on your own. And so really listening and communicating to the needs, even of the patients. They were having trouble with books one time, so we did a book drive, and we do a clothing drive. So when we go down there in the winter time, all of our technicians and doctors and whatever, we do a clothing drive of coats and stuff. And so when we do our winter clinic later in the year, we take all these clothes or books down there, whatever, if they're having, a deficit somewhere or something that they need, that we can add to whatever we're doing. So really listening.
Yeah, the power of partnerships too, to be able to listen and see what people need, but then to know where to send them to, or who to bring into the conversation is critical.
Yes. For sure.
Julie, you mentioned about education and that you spend a lot of time educating. So tell us a little bit more about some of the most effective ways that you feel that you were able to educate those immigrants and refugees you're working with.
Power of pictures. So I have photos and pictures. So when we opened up, we had a huge need to educate our patients about what their conditions are, like cataracts. And I know Prevent Blindness. I know Donna Fishman has told me a lot about the resources that you guys in different languages and things like that. But some of our patients are illiterate, so they can't read. So it's very difficult for them. It was expensive to translate material of, treatments for a dye, for example. What do you do? Glaucoma medications, how do you put them in your eyes? Which ones are you supposed to use? Those are things that we found challenging. So I just took pictures and made my own handouts with these wonderful pictures, from all over the lovely internet. And so what we wanted to do is just make sure that they understood that, and that was the best way. We also have retinal cameras, and we show them pictures of their diabetes in their eyes and what the importance is of managing their diabetes with their, A1Cs being 15, and you're seeing problems. I just had the other day, a patient was returning for cataracts, and then he had no issues, no problems, just following up on his cataract. And then I showed him a picture of his eye. He actually had a vein occlusion in the eye with very little symptoms. And so I'm sending notes to the cardiologist and things like his primary care physician. And so that's been the most helpful for us, in terms of being able to educate our patients of the importance of eye care. And so that has been a real big gap for me. I'm still waiting for technology to help me in terms of education through our our electronic health records and things like that can, pop up like a YouTube. YouTube's great. It has all these videos. Why can't we do this for eye care? So much more. And I know you guys have lots of information on prevent blindness too. And so that's appreciated. But, really to share that information, how do we do that? How do we, improve that? But for me, that's been the biggest help.
That's great. Kristine, how about you? What have been the approaches you take to education?
We really realized early on how important education was as a component of this project. So, as I mentioned, there's so many stakeholders involved in the care of youth in foster care, from foster parents to child welfare professionals to court professionals, attorneys who represent children. And as our team was doing interviews with key interest holders, really realized that lack of awareness of this issue was a key barrier. There's just so many competing needs that people were like, I just never thought about the importance of glasses. So we created a one-page information handout that we could share with key interest holders. I think it's already in the chat. And then we also wrote a blog, and that was my first experience doing a translational product, but I think that's how I ended up in this webinar. Donna Fishman saw the blog, so it really did help to spread the word about the issue and about the work we were doing. And another important piece of education that I hope we can talk about more in the breakout session is the importance of incorporating lived experience perspectives. So we were able to do a lot of qualitative methods with youth who received the glasses, and just heard from them that it was actually a very life-changing experience for them. It really changed the way they saw their whole future, that when they could access glasses. So really, when we're trying to convince someone about the importance of vision care, being able to include that youth perspective, I think really makes it so much more impactful.
Yeah, never underestimate the power of stories and how that can carry your message even further. So, Lori, I know that stories are important in the Native American community, but what are some of the other ways that you've employed education?
Well, I think for us, translating into the Navajo language has been a challenge. I think it's only been a translated written language probably for only about 20 years. They finally had someone start doing the translation of the Navajo language, but really engaging with those community partners again, and just being able to share that information with them. Like everyone else, pictures are worth 1,000 words, and being able to share some of those comparative pictures, things that they need, being able to understand what they're going through or what the changes they have. They can understand a picture either over than the written word sometimes. And just being in that community, word of mouth with each other. We're very fortunate on the Navajo Nation that we have many of the locals that live down there also work at the clinic. And so whenever we are there, they all come, and, it's just a whole big community that we're working together. So it's one big team, who needs what, and being able to really give them good education as far as any help that we can offer them, surgical needs, and just really having time to explain to them in person what is happening, what we can do, and just really being slow and not rushing. Through exams, we tell all of our volunteers, we're not in a rush, right? There's not an emergency eye exam somewhere. Spend time with the patient, get to know them, talk to them, and see what their needs are. And really understanding that is just basic education for them, is that you are willing to listen to hear what their needs are. And so working with those partners that are there, that a lot of them do speak English too. So that's one of the good things, is that there's a lot of them. It's just the elders that speak more Navajo, but having someone there that can speak to them in their language and just have an understanding of what they're saying, but what we're also offering.
Yeah, that goes back big time to the trust as well.
Yes.
So, as I mentioned, this year's theme of our webinar series is Powering Partnerships to Advance Eye Health. And many of you have already mentioned different stakeholders and efforts that you've done to develop partnerships. But what have you seen has been really the most important when working to improve eye care access in your communities? Or what types of partnerships that, maybe members of our audience might not have thought of yet have made a difference in your work? So let's kick it off with Kristine.
I think it'll be interesting to hear everyone's answers and how it might be different for each population. And for youth and foster care, it's child welfare agencies, court professionals, and so that would be unique to our population, but also medical providers like our nursing, physicians, and optometrists, foster parents. And for us, really, like I mentioned, we're doing a community advisory board and getting input from everybody involved programs and thinking through the complexities. To tie into our last question about education, we thought it would be important to educate foster parents about the importance of vision care, and speaking with a foster parent about all the different timing. They get education in the beginning when they become a foster parent, and then continuing education, and hearing from child welfare about how the education is designed. That input is like really essential in designing the intervention. And it was really important for us to develop relationships between our clinic and the optometry clinic at Warby Parker. And so we really got to know each other and our patients. And when our patients would come, if there was a glitch or a barrier, they would just give us a call, and that allowed the patient to go ahead and get their eye care that day. So that was really a great partnership, and really important, I think, going forward to have a partnership with people who can really understand the special needs of the population.
Yeah, that's a long list, but each one really important. So, Lori, how about you? What are some of the different groups you've worked with?
Well, for us, it's probably, making sure that like all the tribal leaders are aware of, the things that we're offering and being able to get them on board. And so once they know that we're coming, they know our calendar, they share that with their different community centers, chapter houses, things like that. Being able to try and get into some of the chapter houses. This is where these communities go for information. They go there for community events in these chapter houses. And so just being able to them understand, what we can offer, and can we get into some of these chapter houses if they can't make it to the community. So being able, the tribal leaders on board, but also all of the administration and staff members, whether it be physicians, the MAs, any of the traveling nurses, to be able to know when we're going to be there, what we can offer. And we did some training with some of the traveling nurses that they know that these patients live very remotely, and taught them how to do basic screenings when they're out in the community or in their mobile unit, to be able to do a basic vision screening, visual acuities, and be able to say, you know what, I really feel that you need to get in to be seen by these other at the community centers. This is when they're going to be there, and they know the importance of getting the eye care that is needed. And so being able to just have everybody within the community knowing. We go into the schools, we do a school every time we go down there as well. Same thing, educating the parents. Hey, we're going to be at your school. If you can't come to our clinic, we go to all the schools, just screening them in the schools, do a complete eye exams in the school gym. The kids get to pick out their own glasses. It's super cute. They don't have their parents around telling them which ones to get, but just making sure that whether it be with the community centers, the tribal leaders, and even just all of the elementary school and the school nurses that we work with.
Wow, surprise. The parents will get to find out what kind of glasses were chosen. That's fun. And thank you for defining chapter house. I was not familiar with that term. So I learned something new today. Julie, how about you? What are some of the different groups that you prioritize working with to serve your population?
Well, I think it's important, like everyone said, is to learn what other people are doing that you're not able to do for these patients. So I think it's important we have a lot of faith-based organizations in the community that really help our patients, and they're connecting us to eye care, and we in return connect others when needed. And then I think it's important for us to serve as a referral base, but also expanding our specialty referral base, because we can't do everything ourselves. So making sure we get to know the different ophthalmology groups in our area, but also in Boston, where some of our patients, their insurance can only be accepted there, making sure that we can quickly access information when needed. For example, I had a patient who wanted to learn more about English, and I was like, I don't know, what are English classes in the community? Let me figure this out. And then the International Institute of New England has said, oh, these are these places that English is taught for free for our community. And I'm like, oh, great, let me print this out and give it to our patients. So, I mean, I always say it's like, if you know one person, that person may know the other person that you might need. Or if you have one group, they might know another group, and then it's all connected. And that's how we actually got connected to Lexi, which is our AI interpretation services that we're using. It's just through these interconnections that the organization has in the community. And we have a wonderful person named Mercy that works at our community health center. She's out there in our community finding these groups for us to be able to make sure that our patients are well served, but also letting them know that we're here. We have all these specialty services like eye care, behavioral health, dental. So it's good to be able to do it both ways. So
I can't imagine the depths of the networks that you all have created, and I'm sure it's picked on a lot from your friends and family as well. But what I'm curious about some of the lessons that you've learned. Maybe you tried things one way and it wasn't quite the right way. What have been the lessons that you've learned to make your partnership successful? Or what can unintentionally create some barriers or challenges that you've found along the way? So, Lori, let's start with you.
Okay. For me, it's flexibility. So, being able to come up with a good plan. I tell everyone, I need a start, I need a middle, and I need an end, because I need to have an understanding of what's happening or what our end game is. What are we trying to accomplish? And being able to understand what those barriers could be that we may run into, because you have to think of everything, every subspecialty. Like Julie was saying, someone who just wants to learn English, we have to think of all those things that we may run into ourselves. And you have to go really wide. You have to think of pretty much everything, because that's going to be the first patient that you see is the biggest barrier. And so being able to understand each subspecialty. Okay, what if we have this? What's going to be the route for this patient? If we have a cornea problem, if we have a glaucoma problem, we have to think about all these problems at the very beginning so that we have a route, so we can say, oh, this is what you're going to do and this is how we're going to help you. You just can't say, sorry, we don't do that, right? That's not really helpful, because they already know that. They're already in that situation. So you really have to think of those things and be flexible and have an understanding of what you can offer and have routes for those things, so that you have a way to service those patients' needs, whether it be pediatric, whether it be adult, whether it be geriatrics, whatever. You have to have all those things under consideration at the very beginning and really have a good plan in place.
Got it. Flexibility and be prepared for anything. So that's what's
Yes.
coming.
Yes.
Julie, what about you? What comes to mind is
Gonna be
a lesson
additive.
you learned?
Yeah, it's going to be additive, Lori, because I agree with you. I think it's important to continuously improve because you're all going to make mistakes and just to learn to improve upon that. And then working with other partners and organizations that are willing to improve with you. So, you know, if my communication with the referral group is not working well, help me improve. What do we need to do? And then letting them know what we need to do as well. And I think the key for me is cultural awareness and making sure, like our patients, our Cambodian patients and other patients from different countries, they don't want to do cataract surgery. It's a cert that they've heard people lose their eye because of this, you know. So teaching them it's safe here, it's a good surgery to go through. And we found that some of our patients who needed low vision aids couldn't get to anywhere to help them. So we got a grant from Blue Cross Blue Shield to buy a ton of aids because people couldn't afford the low vision aids. So we bought them so that now we're able to give them out to our patients that can't go there. But our lessons learned is keep trying, continue to keep learning about your patients. And then the biggest thing too is share your expertise. Like as you go about things, share what you're learning with others. And that's why we're here.
All right. Keep trying. Be flexible. Keep trying. Kristen, what can you add to the conversation?
Yeah, I was also going to say persistence. So, as part of our clinical interventions to help youth connect with glasses, we were able to have a case manager through our grant funding. And the case manager would call the family, help schedule the appointments, and then we were able to provide transportation to the appointments. And a lot of youth were able to connect right away with the glasses, but there were some youth where our case manager followed them for almost a year because they kept having barriers come up, like they had other medical needs or their foster parent had a medical need and they couldn't make the appointments. And with that persistence, we're able to finally connect with glasses that were so essential. So really to keep trying and you'll get to the end of getting connected with the vision care that the youth need.
That'll make a big impact. So we're coming close to time. They've already given me one warning, but I know that you've probably inspired some other groups to explore how you can be serving these different populations. But there's always the question of money. So what were some of the grants or programs or opportunities that you accessed to help launch your work? So I'll start with Julie.
Yeah, I mean, as I mentioned earlier, we've received a couple of grants since we've been open in the last 9 years. HRSA gave us a big grant for the community health center to expand services, which included eye care and dental for us. I received a grant through the Association for the Clinicians of Underserved to expand services into our school-based health center. But I mean, the key, I think, to all of this is collecting data. As Dr. Fortin had mentioned earlier, that's key, making sure that we can provide that data about the need for eye care services, and then advocating for better reimbursements for all of this complexity of care that we're giving, and being able to make sure that, you know, we can get money from different resources, but also being able to pay for getting the payment we receive from insurance companies for this complexities of medical care that we're providing. I think that will be helpful for sustainability.
Excellent. Kristen, how about you?
I was able to mention that we received funding from the Warby Parker Impact Foundation. And what was so important is that it funded a clinical program to access glasses, but also policy work, doing policy interviews and creating policy recommendations and funding some education and evaluation, including qualitative studies of youth. So I think that piece is really important for sustainability. We were also able to receive a grant from the American Academy of Pediatrics for a community advisory board, which is really important for planning and phases, and from a foundation called End Child Abuse and Neglect, because it really became apparent how accessing glasses improves outcomes after trauma and resiliency. So they were interested in funding work on digital diaries, which is a qualitative method that hopefully we can talk more about in the breakout session.
Excellent. Lori, what were your keys for sustainability?
Sorry about that. For us, our program is strictly solely funded all by donation. We get no money from the university. We get no money from the Moran. And so we have to fundraise for all of our money. So reaching out to our industry partners when we are having different events, if they want to support or they want to be the key provider of this thing for whether it be for cataract surgery, we reach out to industry for frames because we make free glasses. Do they have frames that they can donate? Most of the time we get these donations. And then we have a really good donor-based community in Salt Lake City that support our programs. They love the local work. They love working with us within the community. And so we do get a lot of money from our donors that we put into grants, different organizations that we can get money from. But definitely, our industry and our donor community has been our biggest supporter of our program, but they love to see that things are being taken care of in their own community. And so reaching out to those partners.
Excellent. And I know we're coming to our final minutes, and there were so many more questions I wanted to ask. But Lori, I'm going to stick with you for a moment. What would be your one sentence takeaway for our audience? What do you want them to think about with serving the tribal communities?
For me is just being flexible, being willing to figure out what the needs are and being able to provide those things. There's such a great need everywhere, and really focusing in on a community where you can make the greatest impact, but also creating something that's sustainable. We tell everyone we're trying to work ourselves out of jobs. So we're trying to figure out a way to create sustainable programs for them to keep going once we leave. And so for me, that's the biggest thing, is just trying to help them help themselves so they don't need us anymore.
I think that's everybody's goal ultimately. Julie, what about you? What's your one sentence takeaway?
I think it's be patient and maintain those active relationships. It can take years to build these programs. And so just keep going, keep being persistent, ask about it, maintain those relationships with your organizations that you're trying to work with. So that would be my takeaway.
Thank you. Kristen.
I think for me, it's awareness. So being aware of the special healthcare needs of youth in foster care, and then also being aware of how helping access classes can really be life-changing for them. And when you're aware of those things, then you'll make it happen and make sure they get connected to the vision care they need.
Yeah, this has been amazing. Thank you all so much for the expertise, the learnings, the humility and stories that you've shared with our audience. This conversation is a great reminder that advancing vision and eye health in special populations takes strong partnerships, thoughtful policies, and real commitment to equity and access and understanding. We hope today's discussion has given everyone new ideas and new energy and new opportunities for collaboration. And before we end this session, I'd like to remind you to keep a lookout for the third installment of our webinar series in October. But thank you to everyone who's joined us today, and have a wonderful day. Thank you.
Thank you for watching. To learn more about the 2026 Focus on Eye Health webinar series, please visit preventblindness.org/FOEH.